I want to talk about stroke. Every 40 seconds, someone in the U.S. has a stroke, and the month of May is American Stroke Month. Right now in studio from Novant Hospital, Novant Health Presbyterian Medical Center, we are joined by Dr. Cara Doyle. She's a neurologist as well as a stroke specialist to talk about American Stroke Month. And Doctor, thank you very much for joining us here this morning. What led you to specialize in stroke medicine?
Hi, happy to be here. Thank you so much for having me. I mean, stroke it's so prevalent and, very impactful on people. So, as you said, every 40 seconds a stroke is happening, and it's extremely debilitating and life-changing. So I think that there's a lot of new research and exciting things happening in stroke. So, it's fast-paced, it's interesting, but very impactful. So.
People think that it starts in the heart, but that is a misconception. Talk to us about, where in the body, the science behind all this.
Sure. So it certainly can originate from the heart, but a stroke, there's two different types of strokes. One is called ischemic stroke, which is where there's an interruption in the blood flow in one of the blood vessels or arteries in the brain, which causes low oxygen to the brain tissue and actually can cause death to the brain tissue. And then the other type of stroke is called a hemorrhagic stroke, which is where the blood vessel literally can burst and start bleeding into the brain tissue.
Mm-hmm. Okay, wow. Some things that we can talk about and how to recognize the symptoms of having a stroke. We've heard this, many have heard F.A.S.T as the acronym. Explain that to us, Doctor.
Yeah, so it's a nice acronym to help people recognize the symptoms of stroke. So we use B-FAST, B-E-FAST, F-A-S-T. B is for balance, so people can all of a sudden develop dizziness or feel off balance and are unable to walk. The other symptom is E for eyes. People can lose vision in their eyes. And then FAST is for face. You can see drooping of the face, usually the lower face, so the mouth will droop on one side. And then A for arm, can be arm weakness all of a sudden. And then S for speech, which could be slurring of the speech or trouble getting words out or trouble, understanding what people are saying to you. And then the T is for time to call 911, because for every second that, you lose oxygen to the brain, all of your neurons can die at that point. So the faster, the better.
Yeah. What are some of the risk factors people need to look out for, and which group of people, age range, does this group or does stroke affect mostly?
Mm-hmm. So typically, stroke really does not discriminate. It can happen at any age, which is pretty scary.
Yeah.
But most commonly, it's usually from around age 45 and up. And usually the comorbidities that make somebody most likely to have or more at risk to have a stroke would be things like diabetes, chronic conditions such as high blood pressure, tobacco use, obesity, and things like that.
Wow. So would you say then most of them are preventable?
Yes, most strokes are preventable. And, I will say, obviously, people can have comorbid conditions like diabetes, high blood pressure, things like that, but as long as they're well controlled, you're definitely at lower risk. So it's usually populations who, aren't seeing a physician regularly, aren't kind of, keeping track of their blood sugar, things like that over time, not exercising, and just bad, overall habits.
I mean, and so what is good for the body is good for the brain, good for the heart,
exactly.
Right? How about for people who have already had a stroke, and what are the survival rates of once you do have one?
So it really depends on, I think, the etiology or the cause of the stroke. Obviously, the bigger the stroke, the more debilitated you will be overall. And it depends on your health state before, right?
Yeah.
But, I don't have a specific number for you, but,
Okay.
It really just depends on the size and the location.
Yeah. How about recovery then? Because we do see a lot of people now being able to live a full life after suffering a stroke.
Yeah, so I'd say the healthier you are before, the better chance you have at recovery. And the biggest thing is that, you want to go to a rehab facility pretty early on, right? Because the longer you're sitting in a hospital bed, the worse your prognosis is going to be. So I've definitely seen patients fully recover, especially if patients are very stubborn, hard-headed, and they're motivated to do it. They can definitely fully recover.
Yeah. How about some of the misconceptions or maybe some of the dangers of, living your life and suffering a stroke?
So Sorry, can you repeat?
Yeah, I mean, are there any misconceptions that people might think about when it comes to a stroke or, false beliefs out there?
I think people mainly, I think the risk of having another stroke after you have one is a question that people have.
Oh, yeah.
And I think, our job as neurologists is to figure out why you had the stroke so we can try to prevent another one, right?
Right.
But it's pretty low, as long as you do what your doctors are telling you. And I think people also get confused about strokes happening all of a sudden. People always say when they come in, it was so weird, they were normal and then they weren't. It's like, that's exactly
Right.
what's concerning for a stroke.
Right.
So,
But they can happen. Oh, you can recognize some of the symptoms over a period of time.
it's pretty fast when it happens.
Okay.
But yes, I mean, a lot of people, wait to come in, which is unfortunate because there's so many treatments that we can do now. And
Right.
Yeah.
Yeah.
So.
Anything else that we need to let people know about, dealing with a stroke or preventing one?
I would say the biggest thing I see is just please go to the doctor at least once a year, to your primary care physician, because I can't tell you how many people come in and with stroke symptoms and they have a stroke, and I tell them and they're shocked, and I said, well, what medical problems do you have? And they say, well, none. And so I always say, well, none because you don't have any, or none because you don't go to the doctor and get yourself checked? And they say, I don't go to the doctor.
Right,
So
Carlene?
it's just so preventable, by going just once a year and making
Right,
sure that you
just
don't
your
have
checkup.
these conditions like diabetes, high blood pressure, things that can easily prevent, a stroke if you just get checked out.
Good advice, Carlene.
Yeah.
Is stroke risk hereditary in any way? Like, is it genetically?
Good
Does it
question.
kind of like, not say run in the family, but you know what I mean?
No, it certainly can be. Sometimes, especially in younger people, they can actually have like blood clotting disorders that are heritable. So certainly, and then obviously, families who have autoimmune conditions like type 1 diabetes, if blood pressure runs in your family, you're going to be more likely to get those conditions as well.
Right. And what way can family, speaking of, support those who have suffered a stroke? What are the things to support our loved ones with a stroke?
Yeah, I think, we see that people do really well, patients tend to do really well and recover when their family is at the bedside, like every day, and really working with them, right? Because we have so many patients in the hospital, and our therapists can only work so much with them in the hospital. So oftentimes, if there's a dedicated family member at bedside, like practicing speech with them and really, moving their limbs for them and working with them, that's a really good prognosticator sign.
All right. Some really important information there about stroke, how to prevent it, how to recover from it, and what you can do now. Get that yearly checkup. Dr. Cara Doyle from Novant Presbyterian Medical Center, thanks for joining us this morning.
Thank you.
Appreciate your time.